Training validation of a novel tissue containment system using a laparoscopic simulator. This study was supported by ARK-AAGL. In this video, we aim to review how training validation occurs, introduce the use of a novel device for contained morcellation, and discuss how simulation training validation plays a role in FDA compliance of device development. Training validation is the process of collecting validity evidence of surgeon training. The use of simulated environments to evaluate surgical competency has been a cornerstone of surgical education. Validation is a process showing that the simulated training session results in the surgeon's appropriate use, clinical interpretation, and decision-making for the desired outcome. Validity depends on how well the surgeon achieves the intended results based on the application of the training. In this study, 12 gynecologic surgeons with experience in power morcellation participated. The surgeons observed all procedures for completion of the critical task, including watching an animated video for concept, reviewing instructions with a video example, watching a simulated procedure, and performing a simulated procedure while reviewing the instructions for use, or IFU. After completion of the training, the surgeons took a mandatory 1-hour minimum break. The surgeons then returned to perform a procedure on beef tongue without any instruction. They then completed a questionnaire for usability feedback, while the bags were gathered for testing for integrity and bacterial and viral loads. The animated video shows the concept of the device, which is a containment bag with abdominal guards in different sizes. The bag goes through the abdominal wall, the specimen is placed into the bag under direct vision, and the bag is inflated using a pump like a blood pressure cuff. The bag is then exteriorized and the guard placed. The specimen is then morcellated under direct vision. Pneumosufflation is not needed within the bag. Once complete, the bag is then deflated and removed. The next video shows more details and best intended practices for placement of the device. This includes the use of different guard sizes to create an appropriately sized abdominal incision, placement of the bag with the bevel up, proper deployment and inflation of the bag, widening of the incision for guard placement, proper exteriorization of the bag to prevent breakage, proper placement of the guard with an Alice clamp, reduction of excess material, morcellation of the tissue, and proper bag removal. Validation of training was first tested on a laparoscopic simulator with a novel simulated fibroid material which was lubricated to more easily pass through the morcellator. Surgeons had the opportunity to ask questions and get feedback during this time, as well as review the IFU and learn troubleshooting techniques. After completion, surgeons took a break. Surgeons then returned for the beef tongue simulation, during which no instruction would be allowed. Both sessions were proctored by a study coordinator and MIG surgeons, and both internal video and external video were used for documentation of technique. Out of the 12 surgeons who participated, 4 were MIGS fellowship trained, 2 were generalists, and 6 were chief residents. All of the bags passed the immediate air inflation test for integrity, proving validation of the intended result. Bags were then collected and sent for testing for bacterial and viral loads, which is still pending at the time of this video. All surgeons said the training and IFU were clear and understandable. All or most felt that the training was adequate for educating on proper use of the device and that they were competent to use the device after the program. Next steps in the FDA-required training validation will be a porcine model for simulated procedures. In conclusion, training validation is an important step in FDA device approval based on the concept that simulation is a cornerstone of surgical education. Simulator performance is a measure of training validation and was confirmed by intact bags at the end of the simulation. Thank you.